interested to hear about what the top claims are through PD insurance. Gives you an idea of what the common things that have been claimed for are. I'm Dr. Cath Watson, and this is the PD Pet Care Vlogs. So the top 5 insurance claims through PD insurance. Number 1, skin allergies. Number 2, ear infections. Number 3, gastroenteritis. Number 4, diarrhoea. And number 5, foreign bodies. So I'm actually going to condense these down into 3 categories because I think that's actually much simpler. First up, the skin and the ears. They were number 1 and 2. I'm lumping ears in with skin because a lot of ear infections actually are secondary to skin allergies anyway. Sometimes they might come into the foreign body category instead because it'll be something like a grass seed down there that's triggered. But often the thing that starts an ear infection actually is because they're having a reaction to something, and the ear canal, which is actually just skin, nice little folded tube, nice dark, warm, moist environment, really good for the normal bugs on the skin to get a wee bit carried away and flare up, being itchy, producing extra wax. And those bugs have got lots to feed on in a perfect environment, so off goes the infection, whether it's yeast or bacteria that are causing it. So the cause is not always obvious, can be pollens, food, grasses, all sorts of possibilities out there, same as there is for skin allergies. Obviously, as far as managing those, if it's food related, you can obviously control what they eat. If it's environment related, keeping a record, particularly if it's happening again and again. Where are they going? What are they doing? What are the weather conditions that's triggering it? Is there some sort of pattern there you can identify so that you know what to look for and when? But also, obviously, so you are going to know what to look for and how to manage that. Because skin allergies and ear infections, while ear infections sometimes are a really simple treatment with just some medicated ear drops, often they are a recurrent problem, and just like skin allergies require ongoing management. That may be something as simple as using shampoos or ear cleaners and occasional medication. It may be long-term medication. It may be desensitisation to allergies if they can be identified. But ultimately, it's an individual plan. We all respond differently and as humans, and dogs are much the same. So we need to work out what works for them and also what you can manage as far as the management goes, and try and minimise the symptoms when they do occur. And the less often those skin allergies and ear infections flare up, the less often you're going to have to treat those problems, and obviously have to make a claim as well. So number 2, I've lumped in gastroenteritis and diarrhoea together. So first up, just want to explain what gastroenteritis is, because it's essentially a catch-all phrase for what's used largely as a catch-all phrase for anything that causes vomiting and diarrhoea. So gastro being the stomach, gastric means stomach, enteritis is essentially your intestines, so the entire intestinal tract. So enteritis on its own is essentially the same thing as diarrhoea, it's inflammation of the intestinal tract. Gastroenteritis just means the stomach's involved as well, so it's the entire gastrointestinal tract that is affected. Why does it happen? Some dogs appear to have cast iron stomachs, can eat anything they like, and they will never vomit or have diarrhoea in any form, just seem to get away with everything, even after eating some of the most disgusting stuff out there. Others just have to look at the sausage on the bench and they're off, just like humans. So often the cause is unknown, but usually it's dietary. So they've scavenged something or they've got a sensitivity to a certain food. Trying to work out what that is if it's happening really often is a good plan. So keeping a diary, keeping a record of what they're eating. You don't always get to see what they've scavenged, unfortunately. But even doing things like food trials can help. But I'd talk to your vet about doing that because it's not just a matter of changing food. For minor tummy upsets, you may not even need to go to your vet. Just like us, 24 hours often these things have passed through. The best thing you can do is offer them usually really bland food, as long as they've got no issues with bland food. So usually the recommendation is things like cooked white rice, cooked shredded chicken breasts, so no fat, no skin, no bones with that. Cottage cheese can also be pretty good. If it's more serious, then obviously they are more likely to need treatment, because dehydration can set in really fast when you're losing all that fluid, particularly if it's coming out both ends. But also because when the gut's really inflamed, it tends to be quite leaky as well, so you're more likely to get infections set up. Other organ systems can also end up being involved and inflamed, things like the pancreas and the liver and so on. So potentially there's going to be blood tests involved. If it's an infectious type disease, then it may be that there's some vaccines recommended or antibiotics potentially, although that's pretty rarely needed for gastroenteritis. But there may be medications required to stop nausea, to stop vomiting, reflux. Generally, we don't give medications to actually plug up the diarrhoea, because the problem needs to work its way through, but we can give medications that help reduce some of the inflammation in the gut and make them feel more comfortable and less painful with all that bloating and gas that tends to come with diarrhoea as well. So number 3 of those top 5 was foreign bodies. So I talked about ears, because we can get foreign bodies in places like ears and the skin, particularly things like grass seeds. We've covered that elsewhere. So mostly I'm going to talk about foreign bodies that get swallowed. So stuff they shouldn't eat and then get stuck. So most of the time, if something gets stuck in the stomach or the intestinal tract, we're either going to need surgery to remove it, or in some cases we may be able to remove it with an endoscope. So that's a tube that we can put down the throat when they're asleep, obviously, and in some cases we're actually able to grasp that object and pull it out. Sometimes these objects are swallowed deliberately because they happen to like the taste and the feel of it and it's worth a try. This is a bit like young kids who like to put stuff in their mouth and just explore the world that way. Sometimes actually it's just accidental. So a dog's picked something up and then they've got a fright, or maybe they haven't been taught how to drop something that they're holding now and had another reward for it, so they think it's going to get taken off them, so they swallow it. So things that are more likely to cause problems: rocks, rubber balls, corn cobs, peach stones, socks, towels. Lots of ways of preventing this happening. If you've got a dog that really likes picking up stuff and carrying it around and is a wee bit prone to swallowing stuff they shouldn't, particularly things like rocks, then actually muzzle training them. And I'm not talking about a muzzle that clamps the mouth shut, but the big basket muzzles. And I'm sure you've seen them on the likes of the racing greyhounds before, and some dogs do wear them out and about in public, and hopefully more will if they're scavengers. Because these types of muzzles, the basket muzzles, actually allow them to pant, to drink, but they can't pick up big stuff. So they can express all their normal behaviours. It's not about preventing aggression. This is about keeping the dog safe from eating stuff that they shouldn't. If you're around home, best thing you can do, if you've got a dog who likes rocks, maybe you just need to remove them from your driveway or garden if you can. If you can't, you might have to limit access to those areas. But particularly for things like corn cobs, making sure they're not in a compost bin or rubbish bin where the dogs can get to them. Things like socks and towels, maybe we just need to train the whole household to pick up their washing and put it in a bin that the dog can't access. I mean a laundry bin, obviously. So it's actually about being aware, just like you are with young kids, and being dog safe, understanding what sort of stuff they can pick up. Just as we'd keep them out of any poisons cupboard, you need to keep them away from objects that they're going to find kind of attractive. Because, like I say, while some stuff we can remove with endoscope, often it requires surgery. That's not only quite an expensive issue for you, or hopefully you have insurance, but it's also quite a painful and quite invasive procedure for a dog to go through too. So if you can avoid it, much better way to go. So that's the top 3 to 5 claims through PD insurance.